Living in a world full of uncertainties, we cannot really dictate or predict what will happen to us tomorrows. Others might be able to avoid something to occur, but with others, unpleasant and unwanted things happen to them. Unavoidable things such as being caught in a bad situation. In this, having knowledge about doing first aid is a very valuable step to take to lessen the effect or even save someone's life. Now, what is first aid? First aid refers to the emergency or immediate care you should provide when a person is injured or ill until full medical treatment is available. For minor conditions, first aid care may be enough. For serious problems, first aid care should be continued until more advanced care becomes available. Learning how to do first aid is a great thing. Example of these first aids are doing the CPR or the cardiopulmonary resuscitation. Second would be cleaning the wounds, and the last one would be doing bandaging. CPR or cardiopulmonary resuscitation is an emergency procedure consisting of chest compressions. CPR always begins with compressions before administering breaths. Rescuers who are uncomfortable performing mouth-to-mouth and do not have a mask may perform hands-only CPR and give compressions at a rate of 100 to 120 beats per minute and at a depth between 2 to 2.4 inches. For chest compressions, do the following. First, position the person on their back on a firm, flat surface. Second, if needed, remove or open up clothing at the neck and chest area. Third, feel for the end of the breastbone or the sternum. Fourth, place the heel of one hand on the lower half of the breastbone. Put the other hand on top of the first. Fifth, press straight down at a rate of 100 to 120 beats per minute and at a depth between 2 to 2.4 inches. Lastly, let the chest recoil completely between compressions. Your hand should remain in contact with the person without bouncing or leaning on the person. Wound cleaning. Wound cleaning or wound cleansing helps optimize the healing environment and decreases the potential for any infection. So, how do you do wound cleaning? Whenever you are cleaning a wound, the first thing that you should do is to wash your hands well to avoid any infection towards the wound. Step 2. Stop the bleeding. Use some gauze and apply direct pressure to the wound. Step 3. Wash it. Wash the wound under running water. Step 4. Clean it. Use an antiseptic cleaning solution to clean the wound. Fifth step. Dress it up. Use a cotton pad and apply a thin layer of antiseptic cream over the wound. Lastly, cover the wound by using either a plaster or some gauze and tape. Remember to always clean and dress the wound every day to make sure that it stays clean and uninfected. Bandaging. A bandage is used to hold the dressing in place over a wound, to create pressure over a bleeding wound for control of hemorrhage, to secure a splint to an injured part of the body, and to provide support to an injured part. Roller bandage. A roller bandage is used to secure a dressing in place. There are 3 types of roller bandage. How to apply a roller bandage. Keep the rolled part of the bandage above the injury and the unrolled part below the injury. Begin by wrapping twice around the injury to hold the end in place. Work up the limb, winding the bandage in spiraling turns, making sure that each new layer covers half of the previous one. Finish by wrapping the bandage around once more and securing the end. Storing and keeping first aid kit in our houses or in our cars is also advisable. The first aid kit should contain the following: antiseptics and cleansers, antibiotics, adhesive bandages, gauze rolls, gauze pads, trauma dressings, first aid tapes, wraps and bandages, first aid instruments such as scissors, tweezers, and tongue depressors, gloves and PPEs, cold packs or instant cold compress, pain medicines, burn care, a guidebook.